Good evening, everyone. Today, our topic is the causes of acute pelvic pain. But today, let us understand the gynecological causes of the acute pelvic pain. You might have got a lot of patients coming to your clinic telling that there is a pain in the lower abdomen. A major pointer to tell it as a gynecological cause of the pain abdomen. The pain should start in the lower abdomen and then spreads to the abdomen. So before proceeding, first we have to know the what is referred pain. Unlike the somatic structures, the visceral structures are not very well represented in the cerebral cortex. What happens now if there is a pain in the viscera? It is not localized to that viscera, unlike it is localized to the skin supplied by the same nerve. Now let us understand the causes of this pelvic pain. So you all know our pelvic cavity contains the uterus, the fallopian tube, the ovary, the urinary bladder, and the rectum. What can cause acute pelvic pain from the body of the uterus? The distension of the cavity can cause the acute pelvic pain, or the uterine cramps during the abortion can cause this pain. The causes of distension are hematometra and pyometra. Next, coming to the tubes. The very most important cause that everyone has to rule out is tubal ectopic. Ask if the patient has any history of amenorrhea, then definitely you have to get a urine pregnancy test done. Next cause, we will talk about the ovarian causes. There are so many cysts which usually happen to a woman. Namely, very important ones are follicular cyst. The second one is hemorrhagic cyst. The third one is the chocolate cyst. What do they actually do? They will irritate the peritoneum and they will leak out the fluid into the peritoneum. The next cause, if this cyst becomes bigger in size, they might rotate and cause ovarian torsion, which will pull the neurological components which is supplying it, and it can also cause pain. The next cause is if there is a tumor over there and it is having necrosis and it has now become complicated, it releases the cytokines and it again causes peritoneal irritation, which is leading to acute pelvic pain, pelvic inflammatory disease. This is an infection which irritates our peritoneum. The next cause is hemoperitoneum. Any other cause leading to the blood collection inside the peritoneum causes irritation of the peritoneum, leading to acute pelvic pain. So, first, what you do is examine the patient, check her BP, check her pulse rate, look for pallor, because we have to rule out a very important cause, that is ruptured ectopic. In a ruptured ectopic, the patient will be pale and she will be having tachycardia. Coming to investigations, what and all you'll send? First and foremost, for a reproductive age group female, please do a urine pregnancy test. The second, you send a CBC. The third, you get a sonography done. And least but very important thing that you have to know is a urinary tract infection. At last, you also have to know a very important non-gynecological causes of pain abdomen, which cause acute pelvic pain. They are, for first and foremost, think about appendicitis. The second cause will be urinary tract infection. The third cause will be renal calculus. And the fourth cause will be intestinal obstruction.